Hello and good afternoon. Welcome to our COVID-19 update with the county's public health experts, coming to you from the safety of their private offices. Apologies for my dog in the background. Today you will hear from the county's Director of Public Health, Dr. Vaughn Dorenoso, who will be followed by Paige Batson, Deputy Director of Santa Barbara County Public Health Department, and Jan Kogler, Emergency Preparedness Manager with Santa Barbara County Public Health. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Kim Rich. Videos of the press conference will be available shortly after the conclusion in English and Spanish on the county's YouTube channel at CSB TV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Dorenoso.
Good afternoon. Today, we will be providing updates about our local status of COVID-19, information on the local vaccination process and planning, and also provide some information on the new mutations of the virus. Next.
Please bring up Dr. Dorenoso's slides. CSB TV, are you able to pull up Vaughn's slides? Thank you.
Gina, I'm not seeing it on my end. Is it on?
They're not up. I'm calling CSB TV at the moment. Okay. Vaughn, is there a way for you to proceed without the slides? Or do you need those as your... They're unable to bring up the slides at this moment. We're going to keep working on it.
Sure, I can. That's fine. I'd like to begin today's briefing with an update on the most recent blueprint metrics and some weekly COVID data. So today's data is for the first week of 2021. So January 3rd through January 9th. Compared to the previous week, this week's metric remains very elevated, although somewhat stable. Our most recent testing positivity was 16%. Our testing positivity rate in the health equity metric increased by 3%, landing at 22.4%. So the implication here is that we need to slow down the disease transmission, not only in all of our county communities, but especially in these communities outlined by the health equity metric. So we typically at this point show you our blueprint slides, which is the rainbow chart. So that will be up after, but our case rate increased by 1%. And our unadjusted case rate stands at 89.3. Our adjusted case rate stands at 64.6. Testing positivity is at 16. Santa Barbara adjusted case rate was adjusted downwards because of the number of tests that we were able to complete in our county. So while testing positivity and the adjusted case rates did not increase like we've seen in the past several weeks, these numbers are still very high and concerning. In addition, ICU numbers for Southern California region remains very problematic. For the past month, the adjusted Southern California ICU capacity has been at 0%. The current 4-week projection done by CDPH for our Southern California region remains at less than 15% ICU capacity. Thus, we remain under the regional stay-at-home order. Looking at our new and active cases by week shows a substantial rise in the past week. So in the first week of January, we saw new cases rose by 24% to 2,882. We saw active weekly cases rose by 36% to 5,401. These large increases in new cases and active cases indicate that COVID is spreading in our county. Next, I'd like to share some data about outbreaks. Assembly Bill 685 requires that business to report outbreaks, which is defined as 3 or more cases within 2 weeks, to our public health department starting January 1st. As a result, more businesses are expected to start reporting outbreaks. And we see that. We saw an increase in outbreaks reported during the first week of 2021. A total of 15 business outbreaks were reported during this time, including 4 in agricultural, 3 in grocery stores, 3 in medical and healthcare settings, 2 in manufacturing, 1 in administration, 1 in a hotel, and 1 in skilled labor. This is an increase of 10 additional business outbreaks compared to the previous week. Congregate care setting outbreaks remain a concern due to vulnerable residents. In the first week of January, 14 new congregate care setting outbreaks were opened. This is an increase of 6 additional congregate care setting outbreaks compared to the previous week. Another source of data is information collected from interviewing of cases. The most recent week of data, cases interviewed between January 9th and January 15th, indicates a majority attending a gathering. Of those that describe attending a large gathering, over 75% attended a gathering with family and friends. This data shows clearly the impact of gatherings around the December holidays and the New Year. Are we able to bring up the slides yet?
Vaughn, they're up. I'm not quite sure what your settings are set at, but right now he's on blueprint matrix or metrics.
Okay, if I can get to slide 4. Great. So this is a quick update on local vaccination efforts. We are currently finished vaccinating the phase 1A, which is the healthcare workers. And we are currently vaccinating as well the 75 years of age and older. Currently, we have not begun vaccinating the 65 to 74 years of age, nor have we started the rest of phase 1B. If you are not currently eligible to be vaccinated, please know that we are planning for your phase. We're actively working to ensure that you will get vaccinated as soon as vaccine is available, and your time will be vaccinated soon. Slide 5. We invite all community members to sign up for our vaccine newsletter to hear of the latest updates with vaccine distribution. Please use our 211 call center. They are available to take your questions and assist you with questions around vaccinations. In addition to this, our medical providers who have been allocated vaccines will be contacting their eligible patients to schedule vaccine appointments. Next. So again, the order of priority for vaccination is really guided by CDPH. First, we have tackled and are tackling the frontline healthcare workers with direct patient care. And then we have started the persons with age 75 or older. And this is a concerted effort with our community partners. And again, coming soon, persons age 65 or older and those at risk of exposure at work in the following sectors: education, childcare, emergency services, food and grocery, and agricultural workers. And we are working on your behalf to ensure that we continue to get vaccines allocated to our county. And as soon as we have additional vaccines, we have built the infrastructure, we have built the partnerships to quickly be able to vaccinate the coming soon categories. Next. This slide shows, and this is available also on our webpage, this shows that we have been allocated as a county 38,075 doses to all Santa Barbara County. And we have ordered what we've been allocated. And our data shows, the data that the state has shows that we have administered 17,032 doses. So that percentage is at 44.7%. Here, I'd like to pause and point out that the state data is lagged by several days. The more current data we have with local tracking puts us at 65% administered of the doses received. So it looks a lot better, local data. Because of a lag with the state, we're showing you what the state has. Next. COVID by the numbers. We are reporting today 342 new cases. We are also reporting 5 new deaths, 2,465 active community cases, 205 hospitalizations with 49 in the ICU, and 0 adjusted Santa Barbara County ICU availability. Next. Please limit the spread of COVID-19 in our community by following the safety precautions that we do know work. Please limit your activity outside the home, outside your home, to what is essential. Do not gather with people outside your household. Keep a distance of at least 6 feet from others. Wear a mask. Avoid travel. Following these guidelines will give the virus less chances to change and will eventually help us to end the spread in our county. Thank you. And with that, I'd like to introduce you to Ms. Paige Batson, Deputy Director of Community Health. She oversees everything COVID related, including isolation and quarantine, including outbreak investigation, including immunization, vaccines. And Paige, welcome.
Thank you, Dr. Del Reynoso. Good afternoon, everybody. Late Sunday, out of an extreme abundance of caution, the California Department of Public Health issued a recommendation for local health departments to pause administration of a single Moderna lot. The reason for this recommendation was due to a higher than usual number of adverse events reported at one community vaccination clinic. 6 vaccinees out of thousands vaccinated required medical attention over the span of 24 hours. All appear to be experiencing a severe allergic reaction during the standard observation periods of 15 to 30 minutes. Nobody required hospitalization. More than 330,000 doses from this lot have been distributed to 287 providers in the state, with no reports of any other clusters or individual events related to this lot. Further evaluation regarding these adverse events are underway, and more information will be forthcoming. It's important to note that all people who get a COVID vaccine should be monitored on site. Individuals who have had a severe allergic reaction or who have had any type of immediate allergic reaction to a vaccine or injectable therapy should be monitored for at least 30 minutes after receiving the vaccine. All other people should be monitored for at least 15 minutes. Typical reactions to the vaccine include pain and swelling to the injection site, and sometimes fever, chills, tiredness, and headache that can last a few days and treated with over-the-counter analgesics. Adverse reactions to COVID are reported via the Center for Disease Control's VAERS database. It's a system that allows for adverse reactions to be reported. At this time, the only time that the local health department is notified of an adverse reaction is only due when a death occurs. Note that Santa Barbara County received 3,900 doses of this particular Moderna lot number, and all providers having received this allocation have reported that none had been administered. At this time, we are also receiving many questions about the new COVID-19 variants that are circulating in California. We know that viruses constantly change through mutation, and new variants of a virus are expected to occur over time. Sometimes new variants emerge and disappear. Other times, they persist. The first variant, identified as B117 in the UK, has been characterized as spreading more easily and quickly than other variants. But there is no evidence that it causes more severe illness or increased deaths. However, it is important to appreciate that an increase in the number of cases will put more strain on healthcare resources, lead to more hospitalizations, and potentially more deaths. The newest variant, identified as 452R, has been detected in several counties in the state, including Los Angeles and San Luis Obispo. Again, at this time, it is too early to tell how prevalent the variant is or if it'll spread more rapidly than others, although this variant has been identified in several other outbreaks. Because we do not yet fully understand how these new variants will behave, it is essential that we continue to rigorously adhere to public health mitigation strategies, such as physical distancing, use of masks, hand hygiene, isolation and quarantine, and vaccination to limit transmission. Thank you. And now I'll introduce you to Jan Kogler, our Public Health Emergency and Preparedness Manager, who will speak to you about our community vaccination efforts. Thank you.
Great, thank you, Paige. So I'm going to talk to you a little bit about our vaccination clinics, otherwise known as pods or point of dispensing. So sometimes you'll hear the term pods, and it just simply means a vaccination clinic. By the end of this week, we will have conducted 11 vaccination clinics since January 5th and given approximately 5,700 vaccines at those sites. We began these clinics, of course, with the prioritized phase 1A healthcare workers that you've been hearing about. And our pod staff have vaccinated fire and AMR and EMS personnel, skilled nursing, assisted living, home care, memory care personnel, and clinical outpatient providers, dentists, mental health professionals, speech pathologists, and many others. You're getting the idea. These are people who are in face-to-face contact with clients, and they have no choice but to work in that way. So all these staff are required to attest that they are in that face-to-face contact. They can't do Zoom visits. And so we really, really need to vaccinate them. And we appreciate that the people that come are those people in face-to-face contact. That allows us to use our limited vaccine for the people who are most at risk due to the nature of their job. They can't stay home, they can't work from home, they can't Zoom from home. So that's really our goal, is to protect those folks, and also including residents, of course, and workers at the skilled and assisted memory care facilities where we've seen those outbreaks. So we're really, really working hard to use our vaccine for them too. I have worked at every clinic, and I have to say our pod staff are very happy to be able to provide these personnel who are at daily risk in their jobs with a level of the protection that the vaccine provides. And our pod staff includes, of course, our own public health department staff, county fire personnel, Allen Hancock College personnel, and many, many Medical Reserve Corps volunteers who have come to us and have been with us for years. Some of them are new, and they're devoting many hours, long hours. Some of these clinics run 12 hours, and they volunteer their time to help with these critical vaccinations. So we thank them. And we continue to vaccinate, as Vaughn said, our phase 1A, and have begun having clinics also for persons 75 years and older. And the clinics are scheduled as the vaccine becomes available. So this week we have quite a bit of vaccine, and we're looking at, probably around 4,500 vaccinations. But we don't know usually until the week before how much vaccine we're going to have for the next week. So we will schedule those as we get more vaccine, and hopefully there'll be a time when we have so much vaccine that we have more vaccine than we can give in a week, and that would be great. This week we had over 1,200 appointments for persons 75 years and older, and we know there's much more demand. Of course, we've got 25,000 or more persons 75 years or older. We were happy to get a lot of those folks in, and we just thank you for your patience and waiting for when we do have more vaccine. We do want to get to everybody. Also, if you're able to make an appointment and then you can't keep the appointment, we do ask the public to cancel it. Please cancel that appointment. Also, if you made 2 or 3 appointments, cancel the rest of those. That allows us to give those very valuable appointment slots to the workers who need them, to make sure that they're as protected as possible. If you need assistance to cancel, you can call 211. So please help us out that way. And we look forward to serving you when it's your turn and when we have enough vaccine. And in the meantime, be safe. And also remember that after you receive a vaccine, you still have to wear a mask, and we still need to social distance. So just because we're fully vaccinated does not allow us to stop having those very safe processes and procedures in our daily life. So thank you very much, and we look forward to serving you at one of the pods.
Thank you, Jan, Paige, and Dr. Del Reynoso. Now we're going to open it up to questions from the media. First up, we've got Melissa Newman with KSBY, who will be followed by Tom Bolton with Newshawk for our first 2. And Melissa, I am searching for you to unmute.
Hello. In a previous press conference, it was said that Santa Barbara County has the highest rate of COVID-19 cases of any county in California. Is that still the case?
What I referenced was the R effective number, and that number is not a constant number. That number is calculated for a time period. And unfortunately, when I attempted to run the numbers earlier today, the site was down, so I was not able to update the number. But we will have it hopefully by Friday to share.
And today, the state auditor's office released a report saying that smaller counties in California got shortchanged coronavirus relief funds. I'm not sure if you guys had the chance to look that over yet, but they do mention Santa Barbara County specifically having higher case numbers and not receiving as much funding as about 16 of the state's larger counties. Just wondering if you guys could share if getting extra funds from the state would be helpful and where exactly those funds go to.
So I have not received the report yet, but I do know that our CEO's office and our board worked heavily to advocate for us to get our fair share of the CARES dollars. It was really due to significant advocacy work and advocacy efforts that we were able to get this $46.1 million allocated directly from the state to us. Um, I also agree that small and medium counties did not get our fair share. Unfortunately, some of our bigger neighbors got a 2 to 3 fold the allocation of care dollars, some directly from the federal government, and some, in addition to their allocation, receive additional allocation from the state. So it is unfortunate that our county did not get our fair share for the population that we do have. And I think that with the money that we did receive, we did our best in really standing up a robust COVID-19 response effort within the public health department and across the county departments as well. And really appreciative of our CEO and our board in advocating for us to have what we did get.
And so the dollar amount that it gives per person, is that like reflected in when someone goes and gets a free test at the county health department locations? Like, is that an example of what those funds are used for? Yes,
it goes the testing, the community partnership, being able to deliver by culturally appropriate, linguistic appropriate health education material, partnering up with our community to do contact tracing, doing isolation and quarantine, all of that. Those are some examples of what we did use the money for.
Okay, thank you.
Thank you, Melissa. Now, next we're going to Tom Bolton with News Hawk, to be followed by Tracy Lair with KYT.
Thank you. Good afternoon. One of the persistent questions we're getting from people is about second doses. People who've gotten the first dose, and now, of course, it's generally not possible to get an appointment to get a second dose. So I'm wondering what's being done to address that situation, and what kind of flexibility is there? How long can you wait beyond the recommended 3 or 4 weeks and still get the second dose?
Paige?
So, yeah, this is Paige. First of all, as far as second doses, we are continuing to receive allocations for second doses. However, in the event that the second dose has to be delayed, obviously it's not desirable, but you can continue with your normal in receiving your second dose at whatever time you can. So we are actively looking at our doses and ensuring that our providers who have been allocated vaccine are receiving it and tagging those doses for second doses. And that includes those vaccines that are being allocated to pharmacies.
So if I got my first dose 3 weeks ago, but I tried to get my second dose and they're saying, sorry, we don't have any doses for you, what do I do?
Well, as I mentioned, I'm not aware that we have not been able to provide second doses. We have all second doses. Thus far, we have been receiving them timely. So maybe we can check after and see what the situation is. But at this time, second doses are being allocated pretty timely.
Okay, well, that's, again, that's not, some of the questions and feedback we're getting is that people are encountering great difficulty on that. My second question is about the status of vaccinations for skilled nursing, assisted living, and group homes and other congregate care facilities. There was a report a week or so ago that statewide, just a very small percentage had actually been vaccinated, and we're getting a lot of anecdotal evidence that that's not happening. So can somebody give us an update on where things stand? What percentage of those patients and facilities have been vaccinated at this point?
Jan, do you want to take that?
Yeah, we receive a report on the skilled nursing facilities, and we can see which have received their first dose when their appointments are. I believe I would have to check my list that all or almost all of our skilled nursing facilities, it's not assisted, have had at least their first dose, and some have had their second. We did have one facility that didn't sign up, and Marion Hospital vaccinated that facility this week. And we have been vaccinating their staff at our pods. So none of our skilled nursing facilities are really off schedule. Some of our assisted living facilities have had more, a little bit more of a delay, because the skilled nursing were the first ones that the pharmacy partnership did, and now they're moved on to the assisted one. So we're following up with them. We did have one in town that looked like they were having some trouble, but I know they were there today. They couldn't do all their staff, so we brought those staff to our pod. So those are our first priority, and we're continuing to reach out, and we will reserve appointments for the assisted and certainly the skilled living facilities. We also reach out to them when we're at the pod site and say, is there anybody who didn't get caught by the pharmacy partnership, and send them over. So I think it's a good question. I would have to check my spreadsheet to see if all our skilled nursing had started. I know not all our assisted have started. So I can look at that perhaps while we do this press conference and give you some more information in a minute.
Yeah, it would be helpful to get a sense. I mean, obviously the skilled nursing was the highest priority, but there's a lot of folks who are in assisted living and group homes. And it's not just the patients, of course, or the residents, but it's the staff as well, who are coming and going and often work in multiple facilities. So it would seem like that would be a pretty high
right. We have reached out to all the licensed care facilities and told them to come to our pods. So now we're following up with them to make sure that they got the message. We do see them coming through today. I saw them coming through, but there's a lot of small ones, right, where there's just 4, 5, 6 people, right, residents, and then maybe 4, 5, 6 staff. And so we just want to make sure that they've all gotten the message, because they are in phase 1A, they are tier 1, and that's where we're seeing the outbreaks, right? So we really want to get to them.
All righty. Thank you very much.
Thank you, Tom. And next up, we're going to Tracy Lair.
Hello, this is Tracy Lair from News Channel 3 and 12. And my question is that the 3,900 doses of Moderna, if they're just creating an allergic reaction, will they be thrown away, or will they be kept so that more 65 and up can be vaccinated? And my final question is, LA already started making reservations for 65 and up. When will that gear up? So those are my questions.
So I can answer the question on the vaccine that is currently on hold. We anticipate that we will know more tomorrow or the day after. We also know that other states have not held the vaccine, and CDC continues to distribute it. So we should know more in the next couple days. We do know that it's also not going to be replaced. So I anticipate that we are going to, it is going to be cleared for use. At least that is my opinion. And as far as vaccinating 65-year-olds with chronic medical conditions and so on, I'll turn that over to Vaughn, because we did have an update from the California Department of Public Health, and it does appear that the framework may be changing. Vaughn?
Yes, earlier we've been in discussion with CDPH about their prioritization, but I think the issue of LA County immunizing or beginning to schedule the 65-year-olds, we would like to do the same, but unfortunately, we don't know the amount of vaccines that we have to even right now fully vaccinate or make available vaccine appointments for our 75-year-olds. So when we look at our local epi data, that is our concern, making sure that the 75 plus group get the opportunity to be vaccinated first, because they are more vulnerable. I believe that we are going to see frameworks nuance somewhat in the coming week, as well as affirmation about what we can expect in terms of vaccine allocation. But at this point in time, knowing that our vaccine allocation is very limited, we need to stay the course and offer vaccines to the 75 plus.
Tracy, did you have additional questions? She muted herself, so it looks like.
No, that's fine. Thank you so much.
Thank you, Tracy. Before we go to Laura Place with Santa Maria Times, for security reasons, we do have a lot of media in the queue. There's at least 4 more. There is a 5th who you've raised your hand, and if we can't identify you in your media outlet, I apologize, but for security reasons, we can't call on you. If you'd like to rename yourself or send me a chat, please do so now. And we're going to continue with Santa Maria Times, Laura Place.
Hi, everyone. Thank you. So my question is about wait lists for vaccines. Just looking at the vaccine page on the county health website, it looked like for health providers, or sorry, healthcare workers who want to sign up for a vaccine through a pharmacy, it appears that they can click to sign up for the wait list. But looking at that, I didn't really see any actual option to do that. So I'm just wondering, is there a wait list option at pharmacies right now? And is there, it doesn't sound like it, but is there a general wait list either being created or in the works for vaccinations?
Jan,
So this is Paige. I can speak to the pharmacy. I'm not aware that there is a wait list. I do know that the allocations that we have given to the pharmacies, those appointments have been filled. We have not been made aware that they actually have a wait list. Jan, do you want to take the other?
So is the question about going to the retail pharmacy online and trying to make an appointment at a retail pharmacy? Or is it about coming to a public vaccination site, like one of our pods?
My question is about pharmacies.
So I don't know that they're doing a wait list. I think once their days are filled, they're filled. So I don't believe that they're not operating a wait list for the general public. I think they're just opening up the site, and when it's filled, it's filled. Now, you have to understand, the pharmacies, the commercial pharmacies, are in the same position that we are. We all have the same pot of vaccine. So when the vaccine is available, we allocate it to them, but they're limited like we are by the total amount of vaccine that comes to our county. So they can't open up any more spots till they know they have vaccine.
Yeah, I understand that. I was just asking because under the vaccine page, and I can send the link, I can follow up after, but
there is one.
It says, yeah, there's a document that's healthcare professional appointment scheduler for appointments at local pharmacies. And then there's links to, making an appointment, and they're filled, as you said, and then it says waitlist link. So I was just curious about that. Okay, thank you. And then my other question is about health equity metrics in those regions that are especially being affected by COVID that Dr. De Reynoso mentioned earlier in her comments. So when you talk about slowing spread in those health equity areas, what does that look like? And does that maybe have to do with increasing vaccine efforts in those areas? And just looking at case rates by region or by, just geographic area, it looks like the North County unincorporated area, like Guadalupe and, New Guayama and those areas, that case rate's especially high. So is that kind of one of the areas you're looking at?
Absolutely. Not only are we increasing testing efforts, we are also enhancing partnerships with local healthcare provider to be able to partner with us on the vaccine distribution. So we anticipate that in addition to the testing, the vaccine distribution, and in combination with health education, prevention, messaging in those communities, we'll be able to see some stem in the upward trends.
Okay, thanks very much.
Thank you so much, Laura. Next up, we'll be going to Delaney Smith with Santa Barbara Independent, to be followed by Grace with Santa Barbara News Press. Delaney, you can go ahead and unmute.
Hi there. I've gotten a ton of my questions already answered today, but I wanted to follow up on a question from earlier about assisted living homes. I was hoping to actually just get the raw number of how many shots are left for assisted living homes. How many doses are left, I suppose. Did that make sense?
Well, so there's two ways that, especially the larger assisted, although all of them could sign up, all of our assisted living were allowed to sign up with something called the pharmacy partnership, which is different than our local commercial pharmacies giving the shots. It's a federal contract with CVS and Walgreens, and they go, and we don't really have anything to do with it. They have a separate pot of vaccine, and they go out and make appointments with the SNFs, the skilled nursing facilities and the assisted living, large and small, to do their vaccinations. And they're contracted to do 3 appointments. At first two to do everybody, and then the third one is the second shot. So I don't know how much exactly the vaccine they have. I know they're going fairly rapidly through our county through the skilled nursing first, right? I'm looking at my spreadsheet now. I'm going to double check, but it's looking like most of them have had their appointment, and then they're working their way through the assisted living. But I think we have so many assisted living that's going to take them a while. So that's why we're trying to pull them to our site with the vaccine we have. And sometimes they bring their clients also to our site, but I don't know the exact amount. I could tell you, that there are thousands and thousands of residents and workers that need to get vaccinated.
Okay. Thank you for clarifying that for me.
Yeah.
And then my other question, I doubt that you have the answer yet, and this is for Dr. Del Reynoso, but I was hoping to put it out there, so maybe we could get it soon. And that is, I was wondering a breakdown on as to who's getting the vaccine in terms of occupation, ethnicity, age, similar to what we saw with who actually contracted the virus, something similar to who's getting the vaccine.
That's a great question. We are quite interested in the demographics of those who have accepted the vaccine as well, and we'll be sharing that once we are able to gather the data, both locally and with via the state.
Okay, great. And all my other questions were answered. Thank you.
Thank you, Delaney. Next up, we're going to Grace McCormick with Santa Barbara News Press.
Hi there. I just have one quick question about the Moderna vaccine lot that's currently on hold. And I know there's probably a lot of information that is yet to come, but there were just a couple things that I wanted to know and see if this is information we have. Just what may have caused a bad lot or whatever they're referring to, and just, how can we be sure that this isn't going to happen to more? And, I know, Paige, you mentioned that it will likely be cleared for use. So does that mean that it was just, a kind of a weird, 6 people, or how can we ease the public's minds with the Moderna vaccine?
Yeah, that's going to be a very important message that we'll have to put out if it is cleared. I think it's reassuring to know that with over 330,000 doses given throughout the state, and only these 6 individuals at this one particular vaccination site in Southern California, to me, it's reassuring that there may have been something else besides the vaccine. As I mentioned, it's currently under investigation. The CDC, FDA, there's a lot of eyes on this matter, and I anticipate that it'll be, I'm sure if it's released, it'll be deemed safe. The other thing that's important to understand is that this is, we are the only state that has held further vaccination with this lot number. So, again, we don't know, and we'll know more in the next couple days.
Thank you.
Thank you, Grace. And next up, I don't see any more local media with their hands raised. It's not too late if you still have a question. So we're going to go to a reporter with 10 News San Diego. Adam.
Perfect, thank you. I'm not sure who would answer this question, but here it is. So today during the state call, Dr. Galley gave a breakdown on how vaccines are allocated to the counties, and that breakdown was a lot more complicated than just size. Counties across the state have been pushing for more doses of the vaccine. Do you believe Santa Barbara County has been allocated a fair number of doses? And what types of conversations is the county having with the state and stakeholders for more?
I am not familiar with the conversation that Dr. Gali shared with regards to allocation methodology. We are consistent with a lot of other counties. There simply isn't enough vaccines. And so in addition to population size, the state, I know that one of the state's methodology, there is risk factor, there is health equity metrics, there is the number of eligible population within the phases, within the tiers as well. I join my colleagues in other jurisdictions in saying that whatever we have is simply not enough. We have built the infrastructure, we've built the partnerships, and we are ready to give vaccines to our community members. So we need to know, and we need to have that assurance that we will get more, because what we are receiving simply is not enough. And that is a message that we share on calls with the state, as well as shared by other jurisdictions as well.
Adam, did you have anything else?
No, that's it. Thank you.
Thank you so much. With that concludes our questions from media. Vaughn, did you want to add some remarks?
Yes, I just wanted to add some clarification. Earlier, there was a question about our highest rate. Again, I want to assure our audience that we don't have the highest case rate. We don't have the highest testing positivity. We don't have the highest HEM, health equity metric testing positivity rate. What I believe the reporter was asking for is the R effective rate, which is really a calculation based on that could tell the community the average number of secondary infected persons resulting from an infected person. So how quickly will that spread? And so I was not able to run the numbers for today, but hopefully the site will be up and we will be able to share the R effective number on Friday. And I want to conclude with, I know that from the volume of calls that we have been receiving, the number of emails that we've been receiving, our community is eager to get the vaccine. And we are working hard with, on your behalf, with our healthcare partners to ensure that we again have built the infrastructure and the partnerships to be able to deliver vaccines when the allocation to our county increases. So we are just as frustrated with the limited number of vaccines that we have, just like you are. But we will be ready when we receive the increase in allocation. Thank you.
Thank you, Dr. Dorenoso, and everyone. That concludes today's press conference. The next press conference is this Friday, January 22nd at 4:30 p.m. For more information and links to the county's public health data dashboard, vaccine information, FAQs, informational videos, and more, please go to publichealthsbc.org. You can also call 211 from the 805 area code for information or to be connected to the county's call center. Outside of the area code of 805, you can call toll-free 1-800-400-1572 to reach our local 211 assistance. Remember to wear a face covering and stay at least 6 feet apart from other people. Wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Stay home and work virtually as much as possible and only leave the house when necessary. And if you feel sick, please stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you, everyone. Have a good evening, and we'll be back here on Friday. Good night.